Hi everyone, I'm Mark Albert. I just want to spend a few minutes talking a little bit about Facelift. We recently sent out an email blast to some patients and the response is really overwhelming. So I thought it made sense to spend a few minutes to verbally walk through some of this. So when it comes to Facelift, usually I do them either local anesthesia or asleep. And that's kind of like two different ends of the spectrum, where you're wide awake under local or you're asleep under general. And I don't really do the in-between twilight. There are plenty of surgeons who do, and they get nice results. For me, I just feel like the other ends of the spectrum are the safest way to do it, because when you're asleep, you completely have an airway that's controlled, and when you're awake, you're controlling your own airway. And in between, I think, is where things can happen as far as safety. So as far as the actual procedure, when I'm doing an awake local anesthesia facelift, basically patients pick up medications at their pharmacy that we call in. They bring them in, they take them by mouth. They're usually pills, a half hour, 45 minutes before. And then they walk into the operating room. I inject numbing medicine, usually in 3 or 4 locations: behind the ears, in front of the ears, the earlobe. And then there's a cannula that goes underneath the skin and it shoots out numbing medicine. And that whole process takes about 5 minutes. And then after that, you really don't feel anything. And most people take a nap on their own accord, and we're chatting a little bit here and there throughout the procedure, but most of the time people are snoozing and even snoring a little bit. As far as the surgical procedure, so there are a lot of different ways to do a facelift, and there are a lot of terms on the internet, like full facelift, deep plane facelift, SMAS plication, deep SMAS, high SMAS flap, and then there's neck surgery, whether you're doing a plication in the midline or you're doing platysmal window or you're doing deep neck surgery. I mean, there are just all of these terms that it's difficult to keep straight. The bottom line is that when you're doing an awake facelift under local anesthesia, you can do any of these things. And the same thing goes for neck work. You can do any neck work awake under local anesthesia. Why do I like local anesthesia? There are so many reasons. Number one, and maybe to me the most important, is that I find that when you're awake, your blood pressure stays constant throughout the course of the entire procedure. And when you go to sleep, oftentimes there are different factors that cause your blood pressure to vacillate a little bit. And when that happens, your risk of bleeding, in my opinion, goes up a little bit. And so I like the fact that your blood pressure is constant when you're awake. Number two, you don't have any nausea or vomiting afterward, usually. And if you do, it's extremely, extremely uncommon. It's usually because you don't tolerate Percocet or you don't tolerate Valium. But again, I can't even think of a case where that's happened. But anyway, after general anesthesia, when you're asleep, it's really common to have post-op nausea and vomiting. And when that happens, not only is it unpleasant for patients, but it's also a risk factor for bleeding, because when you're vomiting, you create valsalva and pressure that can cause bleeding in the neck and face after surgery. What are the other reasons that I like local anesthesia? I love the fact that even every so often patients leave here and they'll go out to lunch with their significant other or a friend immediately after surgery with their dressings on. So you're feeling that good, you're that awake. I also think that it sets the tone for your entire recovery. If you come out of local anesthesia and you don't have a ton of pain and you're not groggy, you just do well with the recovery overall. The last reason that I really like local anesthesia facelift is that a lot of people are afraid of going, quote unquote, going under or having general anesthesia. And that's understandable. There is a certain level of risk. It's extremely low, and we only use the best anesthesiologists for our general anesthesia cases. But it's understandable that people will be nervous about going under. And people always ask, like, do people ever wake up in the middle of surgery? And other questions like that. So there's clearly nervousness around it. And that's the beauty of local anesthesia, is that you're wide awake, you have complete control of everything. And it tends to be a really, really good experience. And I personally love doing these cases awake under local anesthesia. So anyway, if you have any questions, or if I can clarify anything, give us a call at the office. We can do a virtual consultation, complimentary. If you mention this video, I'm happy to waive the consult fee. But I just want to get the word out there that this is really an amazing way to do a deep plane facelift or a SMAS plication or a SMAS flap or neck lift. Pretty much anything can be done awake under local. Thank you for your attention. Bye-bye.